Welcome, everyone. I want to introduce you to our special guest tonight, Shannon Whittington, RN, MSN, CCM, LGBTQ plus Health Certified, is a published author and a certified speaker with the John Maxwell team. Her areas of expertise include LGBTQ plus inclusion in the workplace and servant leadership. Shannon has a passion for transgender health, and she educates clinicians on how to care for transgender individuals after undergoing various gender-affirming surgeries. Shannon was greatly honored to receive the Quality and Innovation Award from the Home Care Association of New York for her work with the transgender population. She recently was awarded the Notable LGBTQ plus Leaders and Executives Award by Crain's New York Business. Shannon is a city and state lobbyist for transgender rights and a vocal advocate for equality of care. To date, Shannon has presented virtually and live at various organizations and conferences across the nation, delivering extremely well-received presentations on servant leadership, transgender health, and LGBTQ plus inclusion. You can follow Shannon on LinkedIn and YouTube, and also look for her upcoming books, LGBTQ plus, ABCs for Grownups and Kindergarten for Leaders, 9 Essential Tips for Grown-Up Success. And just in getting to meet Shannon as we were setting up for this call, I agree with Michelle. She's fabulous. Everyone's going to enjoy her. And I have truly enjoyed our separate conversations prior to tonight. So thank you so much for being here, Shannon.
Oh, I'm really excited to be here. And thank you so much for everyone who's joining me here this evening. You know, I'm glad to talk about LGBTQ plus for pediatrics, and we're going to be talking about advocacy for these young folks. I have a few slides to show you, but I really want this to be more interactive and you all to ask me questions, especially if you've had some of these kids come into your practice and maybe you didn't really know how to handle it. You know, the thing about nurses is that we have an automatic trust factor. We really do. People trust us and they think that we know everything. Have you noticed that? And especially if you're a nurse practitioner, they think that you know everything. I was just doing a webinar the end of last week, and it was for lawyers who have an automatic distrust factor. So I never thought about it like that. And I was like, you know what? Nurses are really trusted to know everything. And then you try to say, well, you know, that's not really my area of expertise, but they're like, but you're a nurse. So as an advanced practice nurse, when you have an LGBT kid coming in to see you, they're going to think you know, and their parents are going to think that you know. Right. All right. So does anyone know what type of flag this is? Anybody? All right. So it's called the progress flag. And this is like a newer flag, or some people call it the chevron flag. So can you see my pointer, Nicole? Okay, all right, great, you're on mute. All right, so these are the regular colors that you see here, but these are additional colors. Like over here, these are the colors for transgender, blue, white, and pink, and brown for people of color. That color has been added into the pride flag. Black for people who have lost their lives to HIV. You know, yesterday was National HIV Day. Let's end the stigma for that. All right, so I'm going to start like really, really basic, and please pardon me if you all already know this, but I never know. So I start at basic LGBTQ plus 101. All right, so what do these letters mean? Well, L is for lesbians. I'm a lesbian, okay? I'm not really crazy about that term. I just kind of use the term gay. I'm a cisgender, gender conforming, binary gay female. I've been with my wife for 21 years. She's downstairs wanting me to be watching some TV show with her, but I'm here with you today. So 2 girls together, that's lesbian. And then you have G for gay, which traditionally means 2 guys together. But like I said, as a gay female, I call myself gay. All right. And then we have bisexual. These are individuals who can be attracted to male or female, okay, or trans, or of any orientation, actually. And the thing about bisexuality is one of my best friends is bisexual, and sometimes she's with a girl and sometimes she's with a guy. And she just told me a couple of weeks ago she wouldn't mind being with a trans person. So it doesn't mean that they're promiscuous. It doesn't mean that they're confused. It doesn't mean that they have to choose as society dictates that they do. It just means that they happen to like whoever they happen to like at the time. So that's what bisexual is. And then we have transgender. And this is an area that's really close to my heart. Transgender individuals disagree with their assigned sex at birth. So if they were born with a penis, they feel like they should have been born with a vagina, and vice versa. This also is an umbrella term for people who might dress differently or who consider themselves to be non-conforming, which means that they don't feel like they fit into the binary boxes of male and female. And then you have the term Q, queer, sometimes synonymous with questioning. And this is where a lot of your kids are going to be in this category, the Q category: queer, questioning, gender fluid, gender expansive. And it just means that they don't really feel like they're heterosexual, so to speak. They don't really feel like they're binary, male or female, so to speak. And this term just kind of encompasses them. And the plus sign stands for like QIA, intersex, people who were born with the anatomy of male and female sexual characteristics. Maybe one is more pronounced than the other. A for asexual. So these are all of the things that can go into this acronym. You know, I always call it the alphabet because it's always growing. It could be LGBTQIAA. You know, it just keeps going on and on. But that's the basics for that. And I want to just talk about that a little bit because I want to make sure that you understand that when the kids come into you and tell you that they're queer or that they're bi or that they're trans, you understand what that means. And as far as intersex is concerned, you know, what's really sad is that a lot of times surgeons are deciding the sex of the child at birth, or parents are deciding the sex of the child at birth, which is really unfortunate. You know, I remember when I was growing up, I had a cousin who was intersex. And I mean, I didn't know this as a kid, but now as an adult, I do. And this person was very troubled, you know? And what happens is when surgeons or the parents decide the sex of a child at birth or early on, later on, as the child grows up, they have a lot of times gender incongruence. Like, I've got a penis, but I feel female. I've got a vagina, but I feel male. So that's why it's really important for the child to make the decision if they grow up to see if they want to do anything about that. Some of them are really proud to be intersex. I think there's going to be more of an intersex movement now, kind of like the trans movement that we're seeing. So I'm really going to be excited to see what happens with that. So I just want to go over these flags really quickly. I don't know if you all saw all of my flags in the background, but this is the newer flag that was debuted, I think it was back in 2017, with those additional colors, the brown and the black. Like I said, brown for people of color, black for people whose lives have been lost to AIDS. So I always ask, does anyone know what this flag is? I'm sure you all do. But do you know what this flag is? This is the flag for transgender. Did you know they had their own flag? Yes, they do. Blue for boys, pink for girls, and white for individuals who feel like they may be non-conforming. So what's great about this flag is that no matter how you hang it, it's always right. And then symbols, you all may remember some of this from school. This is a symbol for two girls together, two guys together, heterosexual union here, and then transgender symbol. So when you have kids that are coming in to see you, and you probably all remember this from school, but gender identity is usually identified between 2 and 3.5 years old. And then they have stability, like knowing what their gender is at between 3.5 and 5. You know, there's a little one who lives downstairs in our building. She thinks she lives here, but she was, let's see, how old was she? 3.5. She was about 4 when she moved here, and she used to come up all the time. And one day I asked her, "Hey, Izzy, are you a girl? Are you a boy?" Or she was like, "Oh, I'm a girl. I'm a girl." And I said, "Well, do you have some people in your class who might be like between boy and girl, or maybe they're a girl and they were born a boy, or vice versa?" And she was 4, And she understood that question. And she looked at me and she was like, no, I don't think so. She's like, but you and Marianne, are you all married? Because my wife is named Marianne. And I was like, yeah, we're together. She was like, oh, okay. Well, I'm not into girls, but I just wanted to know. 4 years old, 4 years old. Gender constancy occurs between 5 and 7 years old. So they pretty much know. And then when we go further into adolescence, they start getting into their orientation, and we know how important that is. This is a little bit more about who I am. I have my own consulting company, which is basically where I teach organizations. I prefer healthcare organizations because we don't know about this, but I teach organizations about LGBT inclusion in our practices. And these are just some other certifications that I got, and I'm not going to go into detail about that so much. But what I want you to think about tonight are your steps for advocacy for LGBTQ plus kids when they come in to see you. The most important thing that I want you to understand about them is that this is a really delicate population. It's a very vulnerable population. 1.8 million LGBTQ youth consider suicide. That's a lot of people. Of all the homeless youth in America, 40% of them are LGBT, right? Because their families throw them out. I mean, think about that. They're 5 times more likely to commit suicide. So when they come in and talk to you, you got to get them at hello. They got to have that trust factor that we were talking about earlier. This is their second leading cause of death. Like, can you imagine that? Depression is huge with this population. Self-harm is huge, cutting, like I said, suicide. And there's about 5% of LGBT, 5% of youth actually who aren't really sure what their sexual orientation is. It's a very, discovery period, so to speak. So 2% of high school students identify as trans, and about 27% feel unsafe in school, traveling to school, traveling home from school. They feel unsafe as being part of the LGBTQ plus population. And 35% of them have been bullied. And we know, unless you've been living under a rock, that these kids kill themselves. And because of that, I don't know if you remember the It Gets Better movement. But so the thing for us to do is to create supportive environments for them, right? Stand up for them, stay informed, try to influence whoever it is around us. And I'm going to show you all some resources here. Maybe you can take a screenshot of this, but these are some really, really good resources. The Trevor Project, they have a crisis hotline, suicide hotline, 24/7. And then the Human Rights Commission has really good resources, a lot of things about health care, equity, and various studies that they've done. And then there's Advocates for Youth, which has a toolkit that you can download. If you go on this website, you can, you got to kind of dig for it, but it's a really good toolkit for that. I want you all to know, I think I'm doing good. It's 8:17. I want you all to know how to reach me. My main connection is at LinkedIn. So if you connect with me here on LinkedIn, even tonight, I'll answer you. I have a really big following there. And I also have a YouTube channel, which really goes into a lot more LGBTQ plus stuff. Like if you want to know anything about pronouns, if you want to know more about what LGBT means, how to have that in your organization. There's a lot of videos that I post around that. I know that you guys probably might have some questions. So I'm going to stop sharing and go into whatever questions that you might have. I'm hoping that gave you like just, I don't know, like maybe like an overview of things to look out for when these kids come in to see you. They really need to know that they can trust you. And if they tell you that, you know, they think they're queer, they think they're expansive, that's like the newest word now, gender expansive, you're going to tell them that's okay. It's okay for you to be that. And you really need to know if they've come out to their parents or not, because you're not going to out them. You're not going to out them to the school. You're not going to out them to anyone unless they've said it's okay and they've talked to their parents. And if their parents are struggling with that, then some of those resources that I listed earlier can help you. The main thing is that these kids need to feel supported and that they feel like they have someone that they can talk to. And as being an advanced practice nurse, there's an automatic trust factor there. And because they reach out to me, even on TikTok and LinkedIn all the time, you know, so yeah.
We do have a question
All right.
coming through. Mimi wants to ask you, how do you ask kids about their gender preference?
Well, you can ask them first, like, what's your pronoun? And they might use gender neutral pronouns. They might say something like they, they, them. And then, you know, you're dealing with someone who's pretty much non-binary, right? They want gender neutral pronouns. It means they don't really identify as female. They don't really identify as male. And then the next thing you want to ask them is, how would you like for me to address you? Like when you ask somebody those questions, what's your pronoun? Like usually when I introduce myself, I say, hey, my name is Shannon. My pronouns are she, her, and hers. I'm a cisgender, gender conforming, binary, gay, female. Like they're just like, oh, this is great, you know? So that's, you know, you can tell them, hey, I'm an ally. Tell me what I can do for you. Yeah, but just ask. Most of the time they'll tell you. Actually, they're happy that you did ask. You know, if you think about it, this is a question. I mean, depending upon your generation, we're not used to asking this question. We're really not, right?
Yes, thank you. We have a question coming in from Sarah. She wants to know, is there a health policy issue that you feel pediatric nurse practitioners should be at the forefront of leading and supporting right now?
I do not know of a health policy issue, but there probably should be one. I don't know. I mostly deal with the transgender space and a little bit, and there's a lot there, right? So I don't know, Sarah. See if there is, let me know. Maybe we can see what we can do.
What types of health policy issues have you advocated for around transgender? Like just as an example of your work and maybe the way you advocated, you know, and lobbied for that particular issue.
Yeah, I've lobbied a lot for transgender rights, right? So I teach clinicians how to take care of transgender patients after they've had their various gender affirming surgeries. So we're talking about top surgery, facial feminization surgery, metoidioplasty, phalloplasty, vaginoplasty. And basically, when I go to city council or in Albany, I advocate for funding for this population. Here in New York, I mean, like New York is the best place to have HIV. New York is the best place to be a transgender person because we have special needs plans for these individuals and all of these surgeries are covered, all of their hormones are covered. So I advocate for additional funding so that we can help. I mean, I didn't get into a lot of the health disparities with transgender individuals, but they have a lot of disparities. So I mostly advocate for that.
Thank you. And then just because I was able to have that separate conversation with you in preparation for tonight, I think it would be interesting maybe for the participants on this call to hear about the patients you work with now and getting to know them, some of their stories, pieces that you can share from growing up, from childhood through to when they met you as adults.
Well, you know, there's studies that show that young boys as early as 6 years old have tried to castrate themselves, right? Because they didn't think the penis should be there. I spent an entire summer at CTMS, the Center for Transgender Medicine and Surgery, when I was doing my practicum for my master's. And every 30 minutes, a patient was coming in for consultation for gender affirmation surgery. And you know, I would get a chance to chat with them a little bit, and they would say, this isn't supposed to be here. You know, they're pointing to what's between the hips, right? This isn't supposed to be here. We had an 80-year-old patient who came in to have chest masculinization surgery, which is basically mastectomy, 80 years old. And he was giving himself this gift of, you know, getting rid of what he felt like shouldn't be there. These individuals, and, you know, I like for trans people, we're talking about a 45 to 55% suicide rate, right? Because society doesn't want them. And I know that's just a statistic, but when I talk to these individuals individually, I see the cuts, you know, and they tell me, oh, I got to get a tattoo. I don't want to kill myself anymore. So it's a lot with these individuals. There's many who are very successful and doing great, but the majority of them live on less than $10,000 a year. And the life expectancy anecdotally is around 35. I mean, unless you've been living under a rock, everybody, we've already had, 28 murders this year already, which is more than last year. We just, you know, like 2 people in Puerto Rico were killed. We had a couple here in New York. Texas has a lot of transgender individuals killed. So yeah, a lot.
Yeah. Well, and I appreciate you sharing that, because I feel like since we do treat children, it's good to hear what's happened for these generations where this wasn't discussed, where it wasn't brought to the forefront, and we weren't even trying, you know, no one was trying to educate themselves to offer the proper care to children through adulthood. So I appreciate you touching on that. We have a few more questions that came through.
Yeah,
Michelle, Michelle is asking, what do you do when parents refuse to accept a child's orientation? Or some strategies around that?
That's a really, really hard one. These are the kind of kids that get thrown out of the house and end up homeless. You know, the only thing that you can do is give them the information. There's so many support groups out there, and there's been studies around this, and there's a lot of controversy around it. And they were saying, oh, these kids are going through a phase, and by the time they're a certain age, they go back to being straight. But it's so many flaws in that study. So basically the main thing to do is say, hey, you know, I had a nurse tell me not too long ago that her 4-year-old, born female at birth, AFAB, a female at birth, only wanted to wear ties, shorts, and topless as a boy. And she had to explain that to the teachers and everything. So you have some parents who will accept these children and not have a problem with it, but then you have some parents who don't. And this causes a lot of strife with the kids. So the only thing, I mean, you can't change the parent's mind, but the only thing that you can do is give them the information and say, you know, here's the information, take a look at it. There's nothing wrong with your child. You know, your child's not abnormal. This is just, and the child, they know, you know, they really do.
Thank you. And then we have a question from Shaka. She is asking, how much do you feel that socialization plays a role into gender questioning?
You know, most of the kids are socialized. We're talking pre-COVID, okay? So let's not even talk about COVID, but pre-COVID, most of the kids are socialized. So they really know within their spirit what their gender is. They do. So I don't really think that really has so much to do with it. You know, I'm writing a book called LGBTQ ABCs for Grownups, and the person who's editing my book is straight. You know, and she keeps saying, I don't understand this, I don't understand that. And I was like, you know, it's not like you have to really understand it, because it's not your brain that's feeling it. Like, I'm gay, you may not understand it, but at least accept it, right? This is who I am. It's not a choice. Like I was saying earlier, for kids, you know, it's not a choice, it's a discovery. They're discovering who they are. I think it's really important to support them in this process. And, hopefully the parents will eventually come around. Sometimes it takes them a long time. The mom accepts them, but the dad won't, or vice versa.
Thank you. Do we have anyone else with any questions? You can raise your hand or type into the chat.
Kelly, are we connected? Like, you're looking so familiar to me, Kelly Garber. Are we connected on LinkedIn? I may be connected with some of you all already.
There she is.
Hi, sorry, I forgot to unmute. No, I don't think so, but I'm enjoying your talk and your presentation. Thank you.
Well, you've got like 100 like certifications behind your wall. I feel like I should know you just because of that.
I do telehealth, so I have to have that wall of things behind me for my patients. So
Got you. Makes sense.
It looks like Mimi just, yeah.
I took a certification from Drexel. I don't know if you remember that prior slide. I took LGBTQ plus health certification from Drexel. It was like a year long. Well, it took me a year because I only did one class at a time. But that was a pretty good certification for me. We have to change what's going on in our educational system, right? Do we blame, our educational system, or do we blame ourselves? The average nursing professional receives about 2.12 hours of education in LGBTQ. I receive 0 hours. I don't know how many you all receive, but all of my colleagues receive 0 hours. I'm still waiting to meet the person that got the 2.12 hours. And I get a nurse intern every semester from Ivy League to no league. And 9 times out of 10, no education. So I was talking to Nicole about this last week. I mean, my big lofty goal is to change this with make NCLEX include 5 questions about sensitivity and pronouns. And we didn't even get into pronouns tonight, but there should be more. I mean, come on, there's 9 million people. There's 9 million LGBTQ plus people in the United States. 1.7 million are transgender. And you know what? We discriminated against them. Us as healthcare professionals discriminate against them. Why? We don't know how to take care of them. Why? We weren't educated. Yeah.
Yeah. Well, I think leading up to that, because we had the other conversation, I think this group, since we have a few more minutes of time for you to speak and answer questions, I think they would find it interesting to hear about how you found yourself in the clinical role that you're in now, and then maybe share a little bit about that interaction you had shared with me about the nurse that works with you.
Oh,
and
okay.
When you were trying to get her to join your team, I feel like this group of practitioners would enjoy that.
Well, I've been in this transgender space, LGBT space, about 5 years. March will be 5 years. Now, I've been gay forever, and I was just, regular nurse taking care of patients. And then one day, Mount Sinai here in New York, which has these top gender affirming surgeons, reached out to our organization, said, hey, we need someone to care for our patients after we come home. So my boss at the time calls me in her office and says, oh, you need to go over here and check this out. And I don't think it's going to be anything. And so I was a new manager at the time, and I wanted to impress my boss. So I go to these lectures and I'm asking all these questions, never realizing that I'm standing in front of Oprah, right? The Oprah of transgender surgeries, Dr. Marcy Bauer out of California. And I'm asking all these questions, and then I start thinking, this is gonna be big, and I go back and I tell her, I'm like, this is gonna be big. I think there's a lot of people who are gonna have this surgery. And she was an old fart, so she didn't believe me. Thank God she retired. But I had to beg nurses to take the training for when we started to see these patients. And the first year we saw maybe 60 patients. Now I have about 25 to 30 patients on my roster who are actively having gender affirming surgery, who are home recuperating. And I had to beg nurses to take the training. right? So the first year, I think I had 28 or 30. And there was one nurse who was just like top notch nurse, like the 1% of nurses, award-winning nurse, amazing. This is the kind of nurse you want to take care of you or your mother. And I asked her, I was like, hey, Connie, you know, I'm doing this training. She was like, nope, Shannon. She just called me like 20 minutes ago, which is so funny. And she's like, nope, Shannon, I'll do anything for you, but I won't do that. And so a year would pass. Hey, Connie, you know, you think you might want to take this training? I don't agree with that. And so last year, one day, just totally out of the blue, she comes up to my desk and she says, Shannon, you know, I've been thinking about that training that you've been doing. And let's be clear, I don't agree with it, but I'm a nurse and I should be able to take care of any patient, no matter what surgery they've had. So I'm really into clinical transformation, right? So a lot of the people that come into my trainings, even if it's in like my organization, or if I'm consulting with another company or another healthcare organization, a lot of times people are there, they have very strong views about this. I always put the elephant up on the wall, right? And I always say, I'm not here to convert you. And that's the same thing for all of you. But I'm here to alert you, this isn't going away, all right? It's just going to get bigger and bigger. So one day she came to my desk and she said, you know what? I've been thinking about that training that you're doing, Shannon, and let's be clear, I don't agree with it, but I'm a nurse and I should be able to take care of any patient, no matter what type of surgery they've had. So she takes the training. A week later, she has her first patient. And she comes to me and she says, Shannon, I get it. She really should have been a girl. Can I just take care of these patients exclusively? I love this population. And she's had about, I don't know, probably like 10 or 15 patients now who've had this, Nicole. So like, to me, that's a success story. You know, when you have people who come in who have their various religious beliefs or cultural beliefs or whatever it is, for them to just say, you know what, I can put that aside and provide affirming care to these individuals.
Thank you. I love that story when you shared it with me last week, because I think it just really speaks to the heart of a nurse, that we really do, no matter our training, we do want to take care of everyone. And we're trained that way. So I just love to see that come full circle with that particular nurse.
Yeah. I have a video of it too. It's like so cool.
Yes, it's a great story. So we are at the end of our question and answer time. So thank you so much for being here tonight. You're such an enjoyable speaker. It was very entertaining. I know I enjoyed it. I'm sure others on the call enjoyed it too. I see some clapping hands coming up on
Jill.
on the Zoom.
Chaka, thank you.
Yes.
So I know you all have some business to take care of, so I think I'm going to sign out. But make sure you connect with me on LinkedIn tonight, tomorrow. I answer everyone's DMs, and well, let's stay in touch.
All right.
All
Thanks,
right,
Shannon.
All right. Bye, everybody.
Bye-bye.